Hello friends, let us now learn some important points about the pseudocyst of pancreas. So pancreatic pseudocysts. So these pancreatic pseudocysts are actually these occur as a complication. So these can occur either as a complication of either acute or chronic pancreatitis. So either acute pancreatitis or chronic pancreatitis, both these can result in pseudocyst. This pseudocyst will comprise of it consists of almost 75 to 90% of cystic lesions of pancreas. Among all the cystic lesions of pancreas, 75 to 90% of them constitutes the pseudocyst. And the pseudocyst is actually an anechoic structure, number one, and it is surrounded by either a fibrous tissue or granulation tissue. The wall consists of fibrous and granulation tissue is present in the pseudocyst. There is no epithelial lining because that is one important thing. Most of the cystic conditions will have an epithelial lining, but the pseudocyst does not have an epithelial lining, but what it actually has is just a fibrous and granulation tissue is present in the wall of a pseudocyst, but there is no epithelial lining. And if you see the prevalence of pseudocyst is more common in patients with chronic pancreatitis, and almost 20 to 40% of patients with chronic pancreatitis might present with pseudocyst, whereas the incidence of pseudocyst in acute pancreatitis ranges from 5 to 16%. So it is more common in chronic pancreatitis than in acute pancreatitis. Sometimes, or you can say rarely, or sometimes they can be caused by trauma also in some situations. So sometimes pseudocyst can also be caused by trauma. Then, so one important thing or differential diagnosis of pseudocyst is cystic neoplasm, and it is very important to differentiate between a pseudocyst and cystic neoplasm, because both of these are very important to differentiate, because both these have different clinical outcome and different management. So differentiating a cystic neoplasm with a pseudocyst is very important. Pseudocyst can be present as a purely cystic collection. It can either present as purely cystic collection, or it might be present as a complete anechoic cyst like this, or it might present with irregularities. It might have mural irregularities might be there, or there can be irregularities might be there, or there can be septations might be there in the wall, or there can be presence of internal echoes might be there. So why are all these might be present? This is because the internal echoes may be because of debris. Why is there this debris? This debris is because of necrosis and hemorrhage. Whenever there is necrosis and hemorrhage in the cyst, this necrosis and hemorrhage which is present, this might present with some irregularities, septations, and also presence of some internal echoes might be seen. So differentiating this cystic neoplasm with pseudocyst is very important. So this cystic neoplasms, if you see the differential diagnosis is one, as we have seen cystic neoplasms. So what cystic neoplasms can mimic has pseudocyst. Cystic neoplasms can be serous cystic neoplasm. We have serous cystadenomas of pancreas. We have mucinous cystadenomas of pancreas, or we also have intraductal papillary mucinous neoplasm. So all these might mimic pseudocyst of pancreas. So these should always be kept in mind. Okay, next. So how are you going to treat the pseudocyst? If you see the treatment of pseudocyst, conservative management is most important in patients with pseudocyst. Mostly it is conservative because most commonly the pseudocyst will resolve spontaneously by themselves unless there are some complications. Okay, so conservative in those pseudocysts which are uncomplicated. In uncomplicated pseudocysts, we can do conservative management because these will resolve spontaneously. Then, if there is any complication, then we have to do surgical drainage. So, what you should keep in mind are the indications which might require surgical drainage. So, what are the indications for drainage or surgical drainage of pseudocyst? So, when do you drain a patient with pseudocyst? So, surgical drainage might be required if the patient has any symptoms of abdominal pain, because the patient might have this abdominal pain whenever there is hemorrhage in the pseudocyst, or if there is any growth in the pseudocyst. If there is any growth or hemorrhage in the pseudocyst, the patient might present with abdominal pain, then which might indicate the requirement of drainage of pseudocyst. Then, if there is any biliary obstruction, if you suspect any biliary obstruction, or if we suspect any gastrointestinal obstruction, then we should definitely do drainage. Now, if there is a pseudocyst, so what are the complications of pseudocyst? Now there is pseudocyst, and what is the complications? So in the complications of pseudocyst, sometimes from the pseudocyst there might be formation of fistulas. Either there can be internal fistulas or external fistulas might develop from the pseudocyst. That means if this is the cyst, and from this you might see development of fistulas. And these fistulas might go to the pancreas around the peripancreatic fluid, and it might result in pancreatic ascites, because the fluid in the pseudocyst might go into the around the pancreas, resulting in pancreatic ascites, or it might have communication with pleural fluid, and it might result in pleural effusion also. And this pseudocyst, in pseudocyst, one important thing is there is inflammation is present. This inflammation can be due to pseudocyst, or it can also be due to pancreatitis. And this inflammation, which is either due to pseudocyst or due to pancreatitis, this inflammation will digest the tissues around the pancreas and dissect the tissues, and it will result in formation of some inflammatory masses. Okay, these inflammatory masses might be present in neck or groin also. So presence of this or formation of this inflammatory mass is one of the complication of pseudocyst. So if you see the diagrams, pictures, this is the picture showing a pseudocyst. So here this is actually the pancreas, but there is some fracture or you saw laceration which you can see in the pancreas. This is actually laceration of pancreatic body. And because of this, the enzymes or the fluid which is formed from the pancreas will reach this, and it forms the pseudocyst. Then, this is the next picture where this is the pseudocyst. Now the pseudocyst is causing the CBD dilatation, and it is causing obstruction. You can see the CBD dilatation which has occurred, and whenever there is this biliary obstruction, then we should do so the drainage of the pseudocyst should be done. It is biliary obstruction is one of the indication for drainage of pseudocyst. Then this is the picture which is showing this. Here you can see the inflammatory mass. Sometimes the pancreatic enzymes might digest and dissect the tissue planes, and it might reach the neck, or it might even reach the groin, resulting in these masses. This is one of the groin mass which is seen in pseudocysts. Thank you.